Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Arteriovenous fistula. So arteriovenous fistula is nothing but known as the AVF, and the types is it includes the congenital, and that is nothing but the most common, and then there is also the acquired variety. Acquired variety is commonly due to the penetrating trauma, or it can be due to the iatrogenic causes. Now next, surgically created. So surgically created fistula, it includes the breccia. So this is for hemodialysis between the radial artery and the cephalic vein. Then comes the snuff box. So what about the snuff box? Snuff box fistula. It is a radial artery posterior branch as well as the radial artery posterior branch and also the cephalic vein. Then comes the Fmge fistula. The Fmge fistula is it is a radial artery and the basilic vein. So radial artery and the basilic vein. Next we look at the pathophysiology. For pathophysiology, there is a arterial blood. So arterial blood, it flows from the heart to the periphery. So after it flows, the venous blood, it flows from the periphery to the heart. Next is the fistulas. The fistulas creates a high to low pressure. So this high to low pressure, and this leads to from the egress venous return and the cardiac output, as well as the heart rate and the systolic blood pressure. Next is it results in a wide pulse pressure. Wide pulse pressure is seen, and pulsating mass as well as a palpable thrill. Next is the chronic cases may show the vein arterialization. Next is the Nicoladoni's and the Branham sign. The Branham sign. The Branham sign is compression of the artery proximal to the fistula. It leads to the decrease, so the compression of the artery. So compression of the artery, it is proximal to the fistula, and this leads to the decrease in the size of palpable mass, decrease in size of the palpable mass, and disappearance of the palpable thrill, as well as decrease in the heart rate. Next is how do you diagnose this? Diagnosis is basically by the angiography. That can be diagnostic and therapeutic, and then treatment will be by the small fistula. The small fistula includes the embolization, as well as there is a large fistula. Large fistula, it includes the surgical ligation. To learn and grow daily like this, please do subscribe.